talk and share ideas, and I think it's awesome how we've all kind of focused on different aspects of being a female chiropractor. So today I'm going to talk a little bit more about motherhood and practice and how it's possible to do both and not totally lose your mind. Because I'm kind of in the trenches right now. I have a 4-year-old daughter, and I have a son who just is now 20 months old. A little bit about me and how I got where I am now. I graduated from Northwestern in 2007. Yay, Northwestern. Are there any Northwestern students? Okay, thank you. And I went into practice with my dad in a small town in Wyoming, and that lasted 6 months. Because my dad and I are way too much alike. And so I figured out pretty quick that we had to change something, and I opened my own practice in the next town over. And so I live in Worland, Wyoming. Nobody knows where that is. Oh, thank you. We'll have to chat. Which is a town of 5,000 people. And I started out in a tiny little cave of an office with my portable table, my lifetimer table, and a whole bunch of used furniture. I mean, I paid maybe $2,000 over with equipment when I started out, no business loans. Opened my doors, started doing what I love. Very quickly, within a year or two, moved into a nicer building that I was able to design the build out of. And just this month, I moved into a clinic of 3,000 square feet that is just my dream building that I should be in for a very long time. So it can be done cheaply and slowly and in a small town, and I love small town practice. I do it all. I love babies, and I have a passion for working with pregnant moms and moms in general, but I see lots of oil field guys. I think my largest patient so far, we were talking about adjusting large people, is maybe 400 or 500 pounds. And I love my little old ladies too. I love it all. And I really like the diversity of small town practice. I'm also active in my town in other areas that I'm passionate about. I'm a La Leche League leader, which is a breastfeeding support organization. And I'm a passionate advocate about natural birth because I had a home birth with my son here recently as a VBAC, which is not easy to do in Wyoming. So I'll have to chat with you about that too. So I'm here to tell you it's possible to be a busy mom and to do lots of things at the same time. So we're going to talk about a few different points. It's going to rock your world, motherhood, we're talking about. Making the decision to have a child, it is momentous. It is to decide forever to have your heart go walking around outside your body. Who's already a parent in this room? Any hands? Fantastic. With a lot of respect for you going through school as a parent. That is not easy. I want to tell you about a little thing called hormones. A lot of you, we talked about bossy, and a lot of you are ambitious women like myself, and you're probably thinking, I'm going to have a baby, and I'm just going to get right back to work. It's going to be a little blip in my career, and I'm going to keep on going, and I was there too. And this baby is going to rock your world and change and turn your priorities completely upside down. And so I just want you to be aware of that and be mindful that you don't know what's going to happen when you become a mother. And there's a lot of unknown out there, and give yourself some grace to figure it out and make your own path. This is my son getting an adjustment about 5 months old. Hormones are amazing things. And biology is an amazing thing. There will be days as a working mother where you are ready to quit completely. You are ready to close it down, and because your child is sick or your child needs you, or it's just life is overwhelming and you're like, I can't do it all. And because your child always comes first, no matter what, your child always comes first. But that's life as a working mama. We have a biologic drive to be with our children, which is a wonderful, amazing thing. But I was not cut out to be a stay-at-home mom. I've always known that. I work about 25 to 30 hours a week, see about 150 patients a week, and I just really feel that's an ideal balance for me right now. Because when I'm home with my kids, I make the most of that time because it is limited. And I really value that time. And I always tell my patients I work way harder at home than I ever do at work because I have 2 small children and they're completely exhausting and wonderful. But it's all about balance. When I was sitting in your seats in chiropractic school, I had no clue how this was going to work, this whole pregnancy thing. Could I work while I was pregnant? Can you adjust somebody while you're pregnant? Is the belly going to get in the way? Can you do side posture pregnant? And so I wanted to kind of address that a little bit and tell you it can be done. This is another great quote. Growth demands a temporary surrender of security. Pregnancy is an overwhelming thing. And everyone's pregnancy is different, of course. I was really, really lucky to have very uncomplicated pregnancies. I worked right up until 40 weeks till my due date with both children, and I wish I had kept working because I went a week and a half overdue and about lost my mind in that week and a half because I had nothing to do. And so it can be done. I do side posture, I do kind of a kick pull with most patients, and I did that right up until 40 weeks. With most patients, there are a few that I had to alternate, and I did a little bit more drop towards the end. But I want you to, especially while you're in school, get as many tools in that toolbox as you can. Even if you're learning an adjustment and you're like, I'm never going to do that. I remember that, and boy, I use them. You never know when somebody's going to walk in and your standard thing just doesn't work for whatever reason on that patient. And so have some extra tools, at least have seen something once, and remember, maybe I could pull that out, maybe I can figure that out on this patient, because you never know what you're going to need. I think some of the hardest part during pregnancy actually was the beginning when you're exhausted and you're nauseous, at least I was, and getting through a full day of patients is utterly exhausting at that stage of pregnancy. So be prepared for that. When at all possible, try to build up a good emergency fund before you decide to have children, if that's possible. It's not always, planned, of course, but you never know what's going to happen. In the back of my mind during both of my pregnancies was always bed rest, premature birth, NICU stay. Holy cow, would that have thrown a wrench into my practice. And this stuff happens. So try to have some cushion, build up some money, build up some savings. There are all kinds of different ways to cover your practice during maternity. And it's great that there are so many options these days. I have a few classmates who work as locum tenens docs who just travel around and just cover practices while docs are on vacation or maternity leave. I was lucky enough to have my dad during my maternity leave, but there are options. There's different ways you can do this. I also want to say, I think you're going to be surprised at how supportive your patient base is during this whole experience. I was amazed by how excited my patients were for me to start this journey and becoming a parent, and how excited they were to watch my children grow in pictures in my office and things like that. So especially in a small town, people are just going to embrace you and they're going to come back. I was terrified that I'm going to come back after maternity leave and they're all going to be gone and nobody will come back to me, but that did not at all happen. I want to remind you here too, get adjusted while you are pregnant. Figure out somebody who's going to take care of you and take care of yourself while you're pregnant. We as doctors are the absolute worst patients, and we take the worst care of ourselves. I'm such a horrible example of that. But it is absolutely imperative that you stay well adjusted, especially if you're working all day long and you're seeing patients all day long. You want to make sure you have some good pelvic alignment before you go do this birth thing. So remember that when the time comes. Make sure you're being well taken care of. My next point is it takes a village. The quote here, I couldn't figure out who actually said this, but figure out what only you can do and delegate everything else. This is me breastfeeding my son at a conference in Colorado Springs. I took him along with my sister to nanny for me when he was 5 months old. And so just an example of balance. The only reason that I am slightly sane and able to do everything that I do is all the people around me. I have an amazing husband who is incredibly supportive of everything I do. He has not always, but he now works from home as a computer programmer, which is absolute heaven, because he, for instance, can stay home with a sick child, where I used to have to cancel an entire day of patients because of a sick baby, because that's what you do. They come first. And when your child has a fever and they're breastfeeding, and you cancel because they always come first. I pay for a cleaning person as soon as you possibly can. I mean, really, that I hate to clean. I hate it. And the first time I hired someone to clean, I'm like, oh, why did I not do this forever ago? Because that's time I can spend with my children. And so that's just a little example, but really figure out what only you can do. Only you can be a mom, and only you can adjust patients. It kind of boils down to that. Hire somebody else to do everything else. I have an amazing office manager who has been with me since my daughter was 3 months old. And she is the reason that I can go home at night and shut off my work brain. And I know that she's taking care of everything else that I don't have to think about. And so that's one of the reasons that my brain can work at home. But I want to talk a little bit about childcare options, because there are tons out there, of course. I had a nanny for about a year, which was great at the time. My son is now in an in-home daycare, and the woman is amazing. The bottom line is find somebody you trust and use your intuition to know that that's the right place for your child, because you want to be able to shut that part of your brain off when you're at work, and you've got to trust the person you're leaving your child with. So research your options. There are options. I was just chatting with a colleague yesterday whose husband quit his job and stayed home for the first year, which is a great option. There are different options for men in many arenas too, and so get creative, which leads right into my next point. Think outside the box. This is a member of the European Parliament with her gorgeous daughter on her chest. She took her daughter to work with her. I was reading an article about her for 2 years. So if she can do it, I think about anybody can. I mean, good for her. And here's one of my favorite quotes. She didn't know it couldn't be done, so she went ahead and did it. And I just love that one. Figure out solutions that work for you. I actually believe that as a chiropractor and a mother, or being a chiropractor makes motherhood easier than a lot of other professions. Because you can be flexible. There are so many opportunities within chiropractic that don't involve private practice, but when you are in private practice, you can make your schedule fit your children. When my daughter was very small, she did not like to take bottles. She liked mom, and who can blame her? But I actually changed my work schedule so that I was living a half hour away from my clinic at the time, which was really difficult. And I changed my work schedule so that I only worked like in 5 to 6 hour blocks. And so I didn't take lunch breaks, I didn't take breaks because I wanted to maximize the time in the clinic, and then I wanted to get the heck out of there and get home to my baby, who had not taken a bottle for 5 hours. And so you can get creative, you can come up with solutions that work, and you can figure out what works for your family. I have also very much found that you figure out what works for you in practice. You figure out your schedule, and the patients will adapt. The patients will come to you who that works for them. That you don't have to you don't have to be the 8 to 5 every day every day of the week kind of thing. You can figure out what works for your schedule. Our next point here is don't wait. And one of my favorite sayings is leap and the net will follow. And I have had that in my head in so many different scary situations. And I want to make a couple of different points here. First of all, there is no perfect time to have a baby. If you wait until there's now is the perfect time, there's nothing else going on, and we're going to have a baby now, it will never, ever, ever come. And so at some point, you got to leap and decide that it's time. My other point about don't wait is don't put off the success of your career or your practice based on what ifs, because you cannot plan for all the what ifs in life. For me, when I was pregnant with my second child here just a couple of years ago, my practice was booming and expanding faster than I really knew what to do with it. And I was pregnant, and I was completely overwhelmed with that success because I have a maternity leave impending, and I'm about to step away from my practice for a couple of weeks. And I was almost like, oh no, too many patients, go away, find somebody else. And I had to step back and go, wait a minute, we've got to actually make these hard business decisions to allow my practice to expand, even though I'm gonna get pregnant, but or I'm gonna have a baby and have to take a little break. But you'll figure it all out as you go. Go all in and figure it all out as you go. Leap, because it'll be okay. You'll figure it out. present time consciousness. I hope you all have heard that term by now. It's a Jim Parker thing. And a great quote by John Maxwell: people don't care how much you know until they know that you care. So in every aspect of your life, when you're there, be present. That is just huge with my life right now, because when I'm home with my kids, I am home with my kids. I make a conscious effort to put my phone away and sit down and listen to my little 4-year-old and what's going on in her brain, because that's the most important thing in her life, and no matter how little and trivial it is, it's important to her, and it's important that I be there to listen to her and play with my 20-month-old, because he is so incredibly fun right now. And then the same goes being present in practice. Be present with each patient at each time. Shut off your brain to every other patient and everything else that's going on, and sit there and look at that person and listen to them. If I could give you one tip about practice success, it's listen to your patients, because so many other providers do not listen. I mean, you've all heard the studies about people get interrupted within, I've seen like 10 seconds and 30 seconds of being in a doctor's office. And so just sit there and listen, and they'll tell you everything you need to know. And then you can fill in with the questions that they might have missed. But you cannot do it all. Another great quote is, do what you can with what you have where you are. I think that the bigger question is not can I do it all, but can I do what's most important for me and for my family? And I think you absolutely can do that. You have to prioritize. I mean, I prioritize on a daily, if not hourly and minute-to-minute basis. And sometimes you get a call from daycare that you have a sick child, and then your entire day gets reprioritized very, very quickly. But figure out what's most important at that day or that time, and make it happen. I am another woman who likes to be involved, and I like to do things, and so motherhood has been a challenge, because my kids come first, and that's who I am now. And so I have to very much limit my commitments. I don't like to be away for bedtime for very many times a week, if any. So I have to limit my evening things that happen. And this is the longest I've been away from my son ever. They're back home with my wonderful husband. And this is the first, he's old enough now that I'm willing to do that, but I have very, very much limited my traveling up until this point, because traveling with children is exhausting, for one thing. And they need me, and there'll be time for that as they get bigger. As I'm wrapping up here, our profession needs you, as we have all said. Another Jim Parker quote, always act one step bigger than you feel. If you're in this room, you're a leader already, and you're going to be the people who are up here and who are going to fill those females, the spots we need women to sit on the ACA's House of Delegates, for instance. And so step up as soon as you feel comfortable in practice, whether it's with the ACA or your state association or your state board or wherever, but get involved and help us to move this profession forward, because we have such momentum building right now. I have a little video. I'm crossing my fingers as this is going to work. You need to harness the power of social media. You probably already all are in school and everything, but in practice, especially in a small town, Facebook is powerful. Most of my little town is on Facebook, which is just crazy in Wyoming. Who would have thought? But my husband helped me shoot this little video. It's 2 minutes long. It took us a lot longer than that to shoot it, and I put it on Facebook, and I did like a $40 boost thing, and oh my gosh, I got, my patients loved it, but I have had so many. Even my patients were saying, oh, I'm bringing my child in because I saw your video online. And the coolest thing, I treat a lot of the doctors in my town. I have such a great little town. I've built such good relationships. I have a great relationship with a spine surgeon who comes to town. I send him all kinds of people, and he sends me people. And he found it and he liked it on Facebook, and so that gave me a little yay. But anyway, this is my son Declan.
Hi, I'm Dr. Sarah Radabaugh, and I'm a chiropractor and the mother of 2 children. This is my son Declan, who's going to be our model today, as I show you what it looks like when I examine and adjust a toddler. Chiropractic adjustments are safe and incredibly helpful for children. Adjustments get the nervous system working at its absolute best, so the body can work properly and heal itself. Some of the most common problems I see in children that improve with adjustments are colic, reflux, ear infections, and constipation. Before I adjust a child for the first time, I do a full examination that takes about 10 minutes. I check the whole body for any problems, including neurologic and orthopedic tests. Here I'm checking Declan's spinal range of motion. I need to be sure that the child is a good candidate for chiropractic care and that there's nothing more serious going on that needs to see a different doctor. Here is Declan, ready for his adjustment. He thinks adjustments are hilarious. We have a special fish table that kids love to climb up on. Here I'm checking his lower back and adjusted it with a gentle push. Adjustments for babies and children are very gentle and safe and don't hurt. Here we're checking up through his upper back to see where we need to adjust, and we'll flip him over. We do lots of clapping with toddlers at this age, and they think it's lots of fun. Here we're going to adjust his neck. I always have a parent nearby so that the child doesn't try to roll off the table. Gentle little push, and we're good to go. Here we're going to adjust his mid-back. At this age, we do that with a big hug. I put my hand behind their back and give it a little gentle push. Declan has a cough today, which is a great time to be adjusted because adjustments help to boost the immune system. I have a passion for working with babies and children because I've seen the amazing changes in little bodies after adjustments. The whole body works better and is more relaxed when everything is in harmony.
That's my peanuts. Mine is very much. I am a nonfiction book junkie, and so I wanted to leave a couple recommendations for you guys for further reading. I brought a copy of Lean In by Sheryl Sandberg, and I wanted to give both of your chairs a copy of that in case you guys haven't read it yet, but everybody should read that book. It's fantastic for any woman in business. Entre Leadership by Dave Ramsey was actually one of the best books about small business and opening a practice and how to, the business side, not chiropractic, but it was fantastically helpful. Anybody who's going to have a baby should read Ina May's Guide to Childbirth. Women's Bodies, Women's Wisdom is another great book about women's health issues and helps you to be a better doctor treating women. How to Win Friends and Influence People, I hope you guys have all read that already. And then Tribes or Anything by Seth Godin. You should be reading everything that Seth Godin has written, which is a lot if you're getting out into marketing. So that is my list, and this could be much longer, but I am also very, very happy to answer questions or talk with students. I'll be here all weekend. Please email me, please grab me, ask me anything. Good luck. I think it's a great time to be a chiropractor. I can't imagine a more fulfilling and rewarding career. I love every day in my office. And I love that my career also allows me to be the mother that I want to be. So, thank you.